Interstitial cystitis bladder pain syndrome is a situation where a woman, more commonly than men, complain of pain, pressure, and discomfort in the region of the urinary bladder, in the region of the pelvis, in the region of the introitus. Pain, pressure, and discomfort or burning sensation, not necessarily with urination, could possibly be a situation where you have got discomfort emanating from bladder filling. Women complain of pain during bladder filling, which gets some relief after urination, which means that the bladder stretches and gives them discomfort. And this is not a symptom of overactive bladder, where the bladder is contracting frequently and making urine. It is also not a symptom of recurrent urinary tract infection, where there's a sudden onset severe burning sensation while passing urine and dysuria, strangury, and you want to pass urine again and again. And sometimes you may land up with pyelonephritis, fever, and flank pain, all correctable and manageable with antibiotics. So, overactive bladder more frequently about contractions of the bladder, which is gone into an inappropriate rhythmic contractions and makes you run again and again. UTI is something sudden onset, acute, severe phenomena because of infection. But interstitial cystitis bladder pain syndrome is something where women more frequently than men in the prime of their life continue to have discomfort, pain, not able to control urine because of the painful urgency, and burning sensation in the region of the pelvis, region of the anal verge, difficult life completely, progressively, month after month, year after year. And treatment has been taken into a different direction, missed out diagnosis, and women continue to suffer. So, if anybody who has got these kind of problems, they're not necessarily overactive bladder, they're not necessarily recurrent UTI. Let's not miss out this important opportunity to contain the bladder health in time rather than allow the bladder to progress to a dysfunctional state of progressively decreasing its size, its lumen, its capacity, its capability to hold urine while the disease progresses internally. I see bladder pain syndrome is a treatable and curable phenomena. Its direction can be changed completely by a timely treatment and pickup. And obviously, the treatment is prolonged. The treatment is something which brings you to life completely and takes you in a different direction, continue to the long term agony which is happening to you, the distress, the kind of aspects of changes which continue to happen. So, in individuals who continue to happen this kind of a discomfort, where you have got discomfort, pain on bladder filling, relieved by voiding, happening for many weeks to many months to even years, flared up on and off and being treated in your cities and your locations by medications, I think it's time to wake up to a phenomena where we should sort it out. We should look forward to bladder pain syndrome to be a treatable phenomena, to be a curable phenomena, and just not leave it only because we're not getting a treatment. Walk out of your homes, see your urologist at the Kokilam and Dhirubhai Ambani Hospital. We'll look into this important healthcare with a lot of understanding, a lot of empathy, helping you and your family out to take this subject to the next level completely. Could be medicines, could be a cystoscopy and hydrodistension. Obviously, what the mind knows is what the eye can see on a cystoscopy. It's important for us to quantify this disease, to look at the scoring of the disease phenomena, to look at the multimodal aspects of discomfort and disgust that an individual goes through, and then treat them and cure them completely. And a subset of individuals who get to see me have got this small capacity fibrous bladder where they're passing urine 40 times a day, discomfort all the time, morning and night, and have undergone all the treatments already all over. We probably bring them a relief and a cure by giving them a substitution cystoplasty or an augmentation cystoplasty where the bladder is rebuilt completely by a new bladder that gives them a life, gives them control, gives them complete relief. And we wish and pray nobody reaches that stage, but a lot of people are missed out in their diagnosis. Women more than men have been treated wrongly as recurrent UTIs, have been treated as sometimes endometriosis, which actually coexist. It's not necessarily that the two different diseases may not coexist. Having seen your gynecologist, having seen your physicians in your cities and your locations, did you happen to be one who has got pain, pressure, and discomfort in the region of the lower abdomen, in the region of the pelvis, in the region of the urinary area and the vagina and the rectum? Are you the one who has got urinary issues along with this, which includes urgency, frequency, leakage of urine, discomfort when the bladder fills up completely, and sometimes painful urgency? Are you the one who has got difficulty in sexuality and you have got pain and discomfort at coitus and sexual intercourse? And are you the one who's suffering for many months to many years and have not got relief or only a partial relief? I think it's time to take interstitial cystitis, bladder pain syndrome in every city, in every country to the front row seat, identify them because this missed out is a progressive phenomena with so much of mind and body issues. And unfortunately, not much is picked up on urine routine and culture and on various tests done to you, and your files only become thicker and bigger, and you missed out completely. So, friends, time to treat your interstitial cystitis bladder pain syndrome in the right time, in the right approach to give you a right direction, which is missing out and you continue to suffer in agony. Thank you so much.